Thank you so much, Mr. Speaker, and I'm truly honored to be standing here and speaking on this bill. I know lots of people are still in the House, and they are all excited about me speaking on this bill as well. So thanks so much for all of you sticking around. But, Mr. Speaker, I want to start off with a quote. As we're beginning to start talking about Bill C-31, and we're listening to what I've been listening to for the last number of weeks, being told that we're not caring about children, I want to read a quote that I received on an invitation this morning that went out to every member of Parliament. So I really hope they're listening and reading their emails. This is from Children First Canada, and I quote from their letter. Once ranked 10th amongst the OECD for the well-being of children, Canada has fallen sharply to 30th place. Children First Canada's latest Raising Canada research suggests Canada has reached a critical tipping point. Many children do not make it to their 18th birthday. The infant mortality rate in Canada is higher than in most wealthy countries, and the leading cause of childhood deaths include preventable injuries, suicide, and homicide. Those that do not survive aren't thriving. 1/2 of kids experience poor mental health in the form of depression. 1/3 experience bullying. 1/4 experience sexual harassment or assault in school before reaching grade 7, and 1/5 grow up on poverty. And you know, Mr. Speaker, I want to read that into the record because we are talking about a program that was just introduced earlier this year, which I believe has not had the appropriate consultation, especially with the provinces. And this is where I'd like to ask the government, what consultation did you do with the provinces? The consultation with the Canadian Dental Association is very clear that they are not pleased with this decision. And so when I'm reading something like this that comes out from the OECD with an astounding negative impact to our children under this government and under this leadership, and they are telling us, well, you don't care about our children? Well, perhaps they should look in the mirror and say, how do we go from 10th to 20th place here? That is something really, really important that we should be looking at. And so I hope that they're reflecting as we're going to have this discussion. I'm coming to this discussion on Bill C-31, looking at the dental and the rental bill as it's being called, specifically looking at the dental and applying my education as a dental health. I had gone to school now back in 1993 when I graduated the program. I know just a few years ago. Back in 1993 and then working in that field for a number of years, and then once I had children, understanding that field as well. I come to this with understanding how these programs work, what it looks to be as a dental assistant or a dental hygienist, or working and teaching people how to brush their teeth. I've had the opportunity to work very close with many dentists, specifically Dr. Charlie Lynn in the City of London, where I have seen the importance of dental health. So when we're talking about dental health, I would have to say in my top 3 priorities, absolutely one of the key priorities when we're looking at healthcare, dental health falls there. But what we're talking about is a program that we want to put nationally. And this is where I say applause to this government for understanding that dental health is very, very important. It is. But come on, you're providing a program that is so not beneficial to Canadian families. And that is what I want to reflect on in this speech today. We know that over 70% of Canadians are already covered under some programs, and we know that the children, specifically here in Canada or Ontario, are covered under a program called Healthy Smiles. Back when I had graduated, it was called the Children in Need of Treatment. If anyone wants to debate it with me from across, go for it, I dare you. The fact is, the Children in Need of Treatment was an excellent program. And is a very, very important program for low-income people. I just listened earlier to the Prime Minister talk about targeted funding. If we want to talk about targeted funding, do what the provinces have asked you to do. Not to yourselves, Mr. Speaker, but to what the government has been asked. They have been asked by the provinces to expand the already existing programs. And that is why I'm saying you've come up with a program that fills this little minute void, looks really great on paper. Meanwhile, you're sitting on $4.5 million, or $4.5 billion, don't get me wrong, $billion that was announced last year's budget on mental health. And the OECD is saying to you, Your children are dropping from 10 down to 20 or 30 in rankings of how the well-being of our children are.
Shame.
And you're putting forward a program that looks great on paper, but if you're asking any bit about the administrative costs, you're going to find out, especially this week, you're going to find out that those administrative costs are not going down to our children, and you are once again wasting taxpayers' money. And that is why I really challenge this government to step back and look at this program. Start talking to the Canadian Dental Association and the Ontario Dental Association. I have read their reports, I have spoken to these dentists, and they are not with this program. I want to read a letter that is done by Atlas. Atlas is a dentist and one of the organizations, and I want to read this. And this is a quote from their newsletter. The federal government's plan for now is both ambitious, ambiguous, and perhaps a little misguided. There are many questions that are yet to be answered before such a universal dental care program comes into effect, such as exactly how much does dental care coverage in each Canadian eligible for? What kind of dental services are covered? Will it be available under public health unit dentists, or health unit dentists, or will it be open to private practice dentists as well? There are some of these answers that are coming out, but at the same time, it does not answer the need. I go back to this, and I'd like to say, quoting, during the 2021 Canadian federal election, the CDA recommended that Parliament conduct a detailed study on improving detailed coverage for Canadians within the first 12 months. Following the election in the interim, the CDA recommended an investment of $600 million over the next 5 years to maintain and expand existing dental care programs delivered by provincial and territorial governments, particularly those targeting vulnerable populations. The reason this is very, very important for me to put in the record is I do not know where the support for this program is, with the exception of the government bench. When we're talking about the dentists, when we're talking to the dental health associations, when we're talking to the public health associations, this is what their needs are, this is what they've asked, and the government is just delivering something totally different. I ask why. Why is this government putting forward a program when people have said this isn't the way to do it? I want to look at the schedules, and this is something when you're looking at dentists and you're looking at these programs, you should look at the schedules. And so let's get into the weeds. A schedule is the lab work. It's the 5-digit code that a dentist has to put in and say, what does this cost? If you're working in something like Children in Need of Treatment or the Healthy Smiles program, there is a special code. So people can go to their dentist, they can have this performed, and there is a smaller cost associated with that. Many of those programs are covered Ontario Works, ODSP, and an assortment. What we're now going to be doing is providing and putting money into bank accounts to Canadians without actually doing the follow-up and investigations that will be needed. I'm going to let them know if they're following the same schedules because you're saying it's going to be public, universal, the same schedules because it is legal for somebody to have 2 different schedule fees. What you're going to find is that they are going to be paying for a pantograph that is now going to be 2 and 3 times what that cost would have been under the Child in Need of Treatment program. The filling that would have cost $345 or would have cost maybe $90 is now going to be $345. You're taking a program that provides the services that Canadians need and that children across this country have gotten. Yes, there are gaps, but what you're replacing it with is a very ill thought out program, and that is why I'm very concerned. I'm going to, in this last minute, just talking about the rental benefit. I'm very proud of my son who finally moved into an apartment of his own. The cost is $1,400. And wow, what a great cost, because it's one of the most affordable apartments that he could find. The average rental costs in our communities are over $2,000. $500 doesn't even pay for a week's rent in the City of London. And so we're putting this Band-Aid approach. Meanwhile, we see the housing markets just skyrocket. And if we want to look at why the cost of these apartments are so costly, we have to look at why the rent is costly. It's because where the house was. And if we want to compare the facts from 2018 to 2022 and look at what the market range is for real estate, we're going to find in some of our communities $250,000 to $300,000 change differences. And this is really, really important to know, because if you're trying to rent out an apartment and your base cost was originally $345,000, you go and buy a home for $650,000, you and I both know that that rental cost is going to be up. And then add these interest rates that we're going to continue to see. As our party has been bringing forward time and time again, we see inflation, and more higher spending by this government. Please put a cap on it, get something done right. fix our healthcare system by actually doing good programs, and stay away from dentists or dental programs until you get it right. This is a failure, and I hope the government can do better. Thank you.
Questions and comments? Questions et commentaires. The honourable member for Brampton South. North, sorry. Wrong direction.
Thank you, Mr. Speaker. I think we all in this House can agree that we want to see good outcomes, good health outcomes for our children. And the member across has mentioned how Canada needs to do better when it comes to our children. So this is one step in which Canada can provide dental benefits to children under the age of 12. And I'd also like to say that this is a first step towards getting it right and getting a more comprehensive approach in the coming years. I'd like to also inform this House and the members opposite that on average in Ontario alone, every 9 minutes somebody walks into an ER with a dental health pain. So just in 2014, we had 61,000 people enter ER rooms for dental health issues. So we're really going to be clearing up our ERs by putting this program in place, and we're going to help other Canadians be able to get the services that they actually need. And the average cost of a Canadian going into an ER room is about $513, and that doesn't even include, complete procedures or hospitalization if that happens. So this is wouldn't the member say that this is a great preventative first step measure?
The honourable member for Elgin, Middlesex, London.
I have great respect for the member, and all I can say is I'm really sorry. You are so off base on this one. I look at the fact that, yes, when we're talking about, not you, sir, not you, but the member, when we're talking about this program, we already have first steps in place. But if you really want to talk about prevention, put that education in the public schools, put that education into the parents' homes. This is where it's missing. We do not have these education programs across our provinces that we once did in the 70s and 80s. We've seen some of that being retracted. If you want to teach education, teach about prevention, and dental health is part of that. But if you want to talk about first steps, work with your partners. That is your first step. When the CDA comes to you and says they want one program, and when the provincial governments are saying the same things, listen. That's where we could do well with these dental programs. Thank you.
That's right. Questions and comments? Questions et commentaires. L'honorable député de Salaberry-sur-Roi.
The honourable member for Salaberry-sur-Roi. Thank you, Mr. Speaker. I thank my colleague for her speech. Just now, I learned that she used to be a dental hygienist in her career. We learn about each other every day, so I see that she really knows what she's talking about. Now I have a more specific question for her. She was a practitioner, a professional in the field, so implementing a universal dental insurance program, it takes a lot of time. There have to be a lot of negotiations with provinces. It's also important to be on the same page with professional orders in various provinces. So it's very complicated. So why does my colleague feel that the government and the opposition party which supports the government insist on moving forward with this, knowing full well that there will probably be more problems than advantages?
You know, it looks really good in the headlines, and it looks really good when we get the government to tell us you don't care about children's teeth. No, we care about a program that works. We care about the economy. We care about the next generations. When we want to talk about spending money right, let's talk about the $4.5 billion that has been sitting in the coffers for the last year under this government when we know we're in a mental health crisis. Just earlier today, I heard that it's a week, a Londoner in the city of, a person in the city of London is dying from an overdose. One person a week. In 2015, I was hearing that from Vancouver, but this is something that's gone across our country. We're talking about dental when we should really be talking about this opioid crisis. Thank you.
Questions and comments? The honourable member for Cowichan, Malahat, Langford.
Thank you, Mr. Speaker. My honourable friend asked a question during her speech, where is the support? Well, I can say in all honesty to her that I have never had a more generous outpouring of support or just total glee at the announcement of a program than I have had with this one. Constituents of Cowichan, Malahat, Langford, the status quo is not working for them. And with respect to my Conservative colleagues, I think they're mixing up C31 with what will eventually be the program. It's important to emphasize C31 is an interim dental benefit until the fully functioning program can come online. So it's important to make that distinction, and I think it's important to understand that Yes, there's room for improvement. There's room for consultations. But right now, people in my riding, Couch and Malahat Langford, the status quo is not working for them. They need help for their children, and they are incredibly happy that I am delivering for them on this promise.
The honourable member for Elgin, Middlesex, London, in 30 seconds or less.
You know, I know
please.
my husband's watching, so my chicken farmer friend over there, I would like to say to him, we already know that under the federal election, the Canadian Dental Association asked for an interim money, put money into a program through the provinces and territories that already exist. That was what was asked for by the provinces and territories. It was what was asked for by the CDA. Yes, people are excited about the headlines, but it's the guts of this that's a real mess. So unfortunately, the headline's great, the guts suck. Thank you.
Resuming